Major medical advances are made each week, and each week the American Health Journal keeps you up to date.
Hello and welcome to the American Health Journal. I'm your host, Roger Cooper. In today's special, we'll visit the doctors of Harvard Eye Associates, clinical investigators for some of today's newest eye and vision technologies. So whether you're a person needing eye treatments for cataracts, keratoconus, or macular degeneration, or just someone interested in medical science so revolutionary it could have only been imagined a few years ago, this is an episode of the American Health Journal you won't want to miss. We began with a medical procedure performed in one way or another for centuries. In the past several decades, cataract removal has become commonplace. Today, we'll learn about two revolutionary technologies in the world of cataract surgery and vision correction that are so scientifically advanced, they sound like the stuff of science fiction. But not all cases of cataract removal are simple. First, we spoke with cataract surgeon and expert Dr. Roger Ohanesian of Harvard Eye Associates in Laguna Hills. We asked, when does the commonplace cataract surgery become complex?
Surgeries that exist in patients who have other diseases as well, other eye diseases as well. They have coexisting eye diseases that when we operate on them, it becomes more difficult. And not only is it difficult, but also because of the manipulations that we do within the eye at the time of the cataract surgery, it makes that this disease can become worse after the cataract surgery. So it's very necessary to protect the eye, and there are ways that we have learned to be able to do that. They can be any age. I've operated on children in their preteens. I've just recently operated on a couple of 30-year-old patients whose cataract had become so advanced that they could not see through them. This one fellow that came in who basically was holding onto the shoulders of his girlfriend because he could not see to walk. He couldn't see obstacles in his way. So that it can occur. And in younger people, it occurs very rapidly. I've got a patient who's got corneal edema, swelling of the cornea, and also clouding of the cornea. Now this makes cataract surgery very difficult because you can't see the parameters, you can't see the details. If a patient has glaucoma, we treat with medications and sometimes laser, and sometimes they require surgery. But if on top of that they develop cataract formation, then it means that the surgery needs to be done in a particular way in an effort to prevent further worsening of the glaucoma. I had a patient who came in with cataracts that were so advanced that he really could not see. He couldn't see the stairs, he could not see the walkway in front of him. He was literally blind, and he was 30 years old. These were all referrals from other doctors. A third of our practice is referrals, and these were sent to us from other eye specialists. And you know, when one eye doctor sends another eye doctor a case, it's usually a tough one. And these were tough cases. I was really pleased, and so of course was he. The lens implants had, in one case, the cataract had gone not only to the cataract being ripe, as we call mature, but overripe. And it was a very tricky case, but fortunately came out very well with lens implants that allowed him to be able to see quite well. He's thrilled with his new vision and is very pleased about it. Retinal detachment is another one where patients who have had retinal detachments have a fluid in the back of the eye that needs to be removed. And when it's removed, again, the support structures within the lens fall back. So now the lens is in a different position. And again, through experience, we know that there's a certain degree of difficulty with that cataract because you're operating many times as if you're operating in the bottom of a well. And so we need to take and make adjustments for that, as well as adjustments to the power of the lens implant that we put in. But again, those are all things that, through experience, you learn over the past 30+ years.
How successful is cataract surgery today, even on these complex cases?
The surgery nowadays under experienced hands, it's about a 10-minute operation, sometimes even less than that. The postoperative postoperatively, your vision is improved that day. It continues to get better and better. We usually see the patient one day after surgery, and they're able to drive one day after surgery. And it's going to last. That lens will remain within the eye for the rest of their lives. They do quite well with it. It's been miraculous.
Stay tuned for exciting and revolutionary developments in lens implants.